Hi friends, today we are going to talk about a very common disease which I see in young girls and women, and that is related to skin. We are going to talk about polycystic ovary syndrome, PCOS, or we call it PCOD, that is polycystic ovarian disease. Skin is always a window to what is happening inside our body. What is happening is in polycystic ovarian syndrome, we see a lot of cases who come to us with acne, facial hair, body hair growth, pigmentation, dark patches on the skin. Sometimes there's hair loss. And this combination of all these issues. Skin and hair issues are, I can say, the most prominent features of PCOD. And almost always they seek medical care for these reasons. But along with that, girls and women also have menstrual irregularities. PCOD, yani polycystic ovaries, where ovaries develop multiple small follicles and do not regularly release eggs. It is also associated with obesity and insulin resistance, where cells do not respond well to insulin. The cause is not exactly known, but it could be because of hormonal imbalance, especially there's an excess of testosterone, insulin resistance. PCOD is also one of the common causes of infertility in women. The hormonal imbalances disrupt the process of ovulation, and without ovulation, pregnancy is not possible. It's not that each woman will have the same symptoms and signs, but there could be a variation in the characteristics of this syndrome. There's no specific test which can be used for diagnosis, but one has to go through a thorough workup, including lab tests and imaging. And then you will have to measure various hormones and like androgens. And sometimes ultrasound of the ovaries also helps. One has to seek care from the experienced gynecologist, endocrinologist, dermatologist, and then you can actually establish the diagnosis. PCOD related acne often flare first on the lower face, including the jawline, the chin, and the upper neck. Although it's not a hard and fast rule, but these areas are considered to be a hormonal pattern for acne for these women. We also notice that these acne lesions are deeper, larger, and very slow to resolve, and they only worsen around the menstrual periods. So sometimes dermatologists recommend use of oral contraceptive pills or certain other medications to treat this type of acne. Hirsutism, which is the excessive hair growth, which is there in places where hair is usually absent or minimum. Common areas are chin, neck, abdomen, chest or back. However, on the scalp there is balding or thinning of the hair which is seen. And that's because of excess of testosterone. Another skin condition also appears, which is called as acanthosis nigricans, which is dark, velvety areas of the skin, usually in skin creases like neck and underarms. This condition is also associated with insulin resistance and may be due to stimulation of skin cells by insulin, which causes them to grow. There is no 100% cure, but there are treatment options for managing the symptoms depending upon your priorities and what your symptoms are. For example, maintaining your weight in the range of you can say a BMI of 20 to 25, and that can lead to improvement of symptoms. So lifestyle modifications of nutrition and exercise might help. Hirsutism can be treated with laser hair removal or electrolysis. Menstrual regularity can be controlled with certain medication. Metformin can be used for medication of diabetes, and that will actually improve the body's response to insulin. So it is a very tailored approach depending upon how symptoms are progressing and depending upon whether the menstrual cycles are regular and whether pregnancy is a goal. Accordingly, the treatment plan changes. So yes, PCOD is treatable, and all those other skin and hair problems can be reduced, and there is a hope for all those girls. Don't worry if you have PCOD. We have everything in a medical science where we can treat your hair problem, skin problem. So if you find this video informative, or if you have any other query, please email us or write in the chat box. Like, subscribe and share our video. Looking forward to seeing you again in the next video. Thank you so much for watching.